Oxygen dependence refers to individuals who require supplemental oxygen therapy to maintain adequate oxygen levels in their blood, often due to chronic lung diseases or other conditions that impair their ability to breathe effectively. Mulago National Referral Hospital, Ward 4A, is a pulmonary unit with bed capacity of 30 dedicated to oxygen-dependent patients. 28-year-old Moses Ockering from Soroti has been a patient at Mulago National Referral Hospital for months with no hope of being discharged soon because he's a patient who needs supplemental oxygen therapy. Ockering says he started experiencing difficulty in breathing, night sweats, and loss of weight, and later was advised to go for medical checkup and was diagnosed with TB.
Basora no kuja kona esi nakolanga wenti omusa kamere basora kolaki kuja kutino nendia sinso savana.
Ockering says being an oxygen dependent has really drained him and family financially to the extent sometimes he misses on his prescription.
Bana bakujanja we nokoboka sente zigenda ziba nyingi kati nawe ngo mulade nzuga mati makerenga twagala scan twagala x-ray twagala ECG twagala echo twagala chini again just like sende kuri manganzo byangu bendebena yari take ko bante na take se ona byagwa bemze bena ni bwa na mama na brother makwata muko ebugwa ndabanga tuli kuziro ngafe na ndika treatment no gamba arikunde treatment naye njamu gamba ntande sina treatment sina dagara sina sende ezo kugula nodara nanga tuna chakora rena kwandika na kutekerao rena odam kwewola sente.
Saul Kiza, a gold miner at Mubende, is another patient who requires oxygen therapy. He has been battling with the condition for almost a year until when he was referred to Mulago for further treatment.
Nenga na bujja mu kirombe Mubende twakanga mu mpuku wanseyo tunonya gorodi tetulina masiki tukolera ku oxygen uno ku generator kanentandi nenfuna obwadde buno enkovu nezigenda amagwe negagenda enkovu naye impisibwa bubi nnyo abasinga bona bafudde mu kirombe nnyo abamu batya bakubikira olw'ensonga ojja kugwamu essuubi naye ng'ekiri mu kirombe kifu nnyo.
Kiza appeals to the government to provide them with affordable and portable oxygen cylinders.
Naye Katonda anyamba buyambi kuba wanoyinza kumalawo bukisinga bbiri bakusibula ng'otereddemu ogera otuuka waka kusinga emu bakuleeta ofa bakuleeta ozirise ng'otaawa ate obulwaliro bw'okumpi tebwagala kuba tebusobola mawuggwe bakugamba ddayo mulago kati mba nasaba gavumenti etuyambe tugondezeeko tufunye ezisirinda za oxygen ngosobola ogenda kawaka n'oba ofunye ataaka yonna nga weteekako bwetiisi n'osobola otutuuka mu ddwaliro awali abasawo bo oba omukono oguli bweru gutukwatamu oba abazungu batuyambeko batuyinze ne ku ddagala kuba eddagala lya bbeeyi terigulikako eddagala litandika $2,000 $3,000 $5,000 okusobola okubeezaawo obulamu.
Kiza's advice to the youths is to always put their safety first when doing and looking for jobs.
Nekira nekubiriza abavubuka ekirombe bakiveemu abagala obulamu bave Mubende baveeyo teri kalamu teri basponsa basobola kugamba nti obulwadde akujjanjabya wefaako wekka tutunze amataka tutunze buli kimu kiweddewo kyonna tusigadde ku bwerinde tusigadde bukyaddi
Ramadhan from Masindi has been nursing his mother suffering from lung disease. His mother was referred to Mulago from Hoima Regional Hospital, where she has been on oxygen therapy for 7 months. Ramadhan says since they have to nurse their mother full-time for all these months, some of them have lost their jobs and others have dropped out of school, and this has affected them financially.
Kwa kilograms za oxygen nya ku 2 nya ku 2 per hour. N'osanga nti bambi kituzitoweredde betuli awo nawo still kibasukkako olaba tukozesawo eddwaliro ekitegeeza bw'anaaba tateredde okubeera nti tudda waka nga tufuna waffe ku lwaffe tuyinza okubeerera ddala mu ddwaliro mpaka ebbanga lyonna kubanga essaawa tuli kuwa eddwaliro.
Dr. William Worodria, a Senior Consultant Pulmonologist at Mulago National Referral Hospital, explains what triggers some of the lung diseases.
Maybe in domestic settings, like cooking, smoke, and other conditions. So those are some of the possible triggers, but the biggest culprit is a material called silica. Silica is found in the Earth's crust. It composes about 25% of the Earth's crust. So you find it in dust, in soil, and all sorts of material. So any work which exposes you to dust, which you inhale, may lead to occupational lung diseases. There are other occupational lung diseases, like in agriculture. You'll say, like in sugarcane manufacturing, there's what you call bagasosis, inhalation of material from the molasses and so on.
Dr. Worodria says such patients, once removed from oxygen, it's like their death sentence has been written.
What we are seeing here is really a tip of the iceberg, and most of these patients are referred from the regional centers and remain here because there's increased access to oxygen. Yeah, and you cannot discharge them because oxygen, one, is expensive. Many of them cannot afford to buy oxygen. So to have oxygen at home, you would need an oxygen cylinder, which you can refill, or an oxygen concentrator, both of which are beyond the reach of most of the average Ugandans we admit here.
The executive director at Mulago National Referral Hospital, Dr. Rosemary Byanyima, says the hospital has long-stay patients who have chronic conditions due to obstructive airway diseases.
They cannot go home because they need oxygen and they cannot have enough oxygen from the air if they go back home. So we have long-stay patients. Actually, the longest has stayed with us for 1.5 years. So you can imagine a cost of a patient occupying one bed. That means you can't admit any other patient just because the patient needs oxygen.
Now, health experts want a appropriate policy framework for occupational health in workplaces, especially in nascent sectors of minerals and construction, to curb on the increasing lung disease conditions in the country. Zahara Abigaba, UBC News.